Hmm. Oh, hi. This is Scott with EMT and Fire Training. And today, we're going to break down the question of the week. Question. You arrive on scene to find 4 patients. Which is the one you would treat and transport as a priority? The answer choices are as follows. Answer A, a 24-year-old male who complains of a broken collarbone and a broken wrist. B, an 18-year-old with a systolic BP of 100 millimeters of mercury. C, a 9-year-old who is conscious with respirations of 26 per minute and a systolic BP of 68 millimeters of mercury. Or D, a 64-year-old woman complaining of chest pain with a systolic BP of 120 and a pain severity rating of 5 out of 10. Okay, let's break down this question. We're faced with a triage situation. This means we need to evaluate 4 patients and then determine which is the most critical. We're going to be working with limited information, so it's important not to read too much into any one of the answers. Let's base our decision off the information that's been given. Answer choice A, a 24-year-old male who complains of a broken collarbone and a broken wrist. Your first reaction might be to assume a serious mechanism of injury that has caused fractures to multiple parts of this patient's body. The problem we face is that we don't have any details about the mechanism of injury. Don't assume information that isn't given. We need to think about the information presented. Is a fracture to the clavicle life-threatening by itself? Is a fracture to the bones in the wrist life-threatening by itself? Is the combined injury of both fractures life-threatening to this patient? How critical is a patient who tells you he has fractured both locations? The National EMS Education Standards identifies criteria for patient priority. It tells us that patients with major or multiple bone or joint injuries are categorized as delayed under the triage principles. Answer choice B, an 18-year-old with a systolic BP of 100 millimeters of mercury. The first thing you should think about is what should be the normal BP range of an 18-year-old. The National EMS Education Standards tells us that the normal systolic BP range of 13 to 18-year-olds is between 80 and 120. This means the pressure of our patient is in the normal range. With no other complaints that we know of, we would have to place this patient in the minor or hold category depending on which system we are using. Answer choice C, a 9-year-old who is conscious with respirations of 26 per minute and a systolic BP of 68 millimeters of mercury. Pediatric patients are very good at compensating for a period of time, but when they decompensate, they tend to go downhill very rapidly. The normal vital signs for a school-age child, which is ages 6 to 12, is a systolic BP between 80 and 120 millimeters of mercury and a respiratory rate between 20 and 30 breaths per minute. This child is breathing in the normal range. However, the blood pressure is below normal. When assessing the C of the ABCs, we are looking at circulation, which is a reflection of perfusion. Shock is a condition where delivery of oxygen and perfusion of tissues is inadequate to meet metabolic demands. We determine how adequate perfusion is by looking at heart rate, pulse quality, level of consciousness, cap refill, skin temperature, color, and condition, as well as blood pressure. It is extremely important to understand that a pediatric patient with hypotension is already showing signs of decompensated shock. Aggressive shock management needs to take place quickly by positioning the patient properly, keeping them warm, and establishing an IV, getting them on oxygen, and get a rapid transport going. If you can't start an IV at your level, you need to be considering calling for an advanced level responder who can. According to the triage principles outlined in the National EMS Education Standards, this patient would be classified in the immediate category due to the signs of shock. Answer choice D, a 64-year-old woman complaining of chest pain with a systolic BP of 120 and a pain severity rating of 5 out of 10. This patient is presenting with a BP that is within acceptable range for her age, but has a complaint of chest pain. With the limited information we have available, we could classify this patient as having a severe medical problem. Whether the chest pain is cardiac related or trauma related is not important. We're going to follow the triage principles and put this patient in the immediate category for the potential severe medical problem of chest pain. Okay, let's quickly review our 4 patients. Patient A was categorized as delayed, patient B was categorized as minor or hold, patient C was categorized as immediate, and patient D was also categorized as immediate. Well, by using our triage principles, we have been able to eliminate 2 of the patients as being the highest priority. We now need to evaluate patients C and D to determine which would be the highest treat and transport priority of the 2. Patient C is the pediatric patient who is showing signs of hypoperfusion or shock. We're also pretty sure that it's decompensated shock because the low blood pressure is leading us down that path. This patient is going to have the best outcome from a rapid treatment and transport. If not corrected quickly, this patient will progress into irreversible shock and die. Patient D, the patient with chest pain, is still being categorized as an immediate transport, but could be held on scene and treated while the pediatric is transported first if you had to make the decision. So our correct answer this week is answer C. It's the most correct choice based on the information we have. Well, that's all from me. Be safe out there.